everyone. Welcome to another episode of Fridays with Fawn. I'm your host, Fawn Lopez, publisher of Modern Healthcare and Vice President of Crane Communications. Today, I'm very excited to welcome a friend, Dr. Ninfa Saunders, President and CEO of Navicent Health. Thank you for joining me today, Ninfa. Welcome.
Thank you. Thank you, and happy to be here.
Thank you. So, Ninfa, we've known each other a long time, and it's been such a privilege to know you and to follow your career. You have an amazing career, more than 45 years of administrative and clinical experience. And you started out as a staff nurse in the ICU. Did you always plan to transition into administration? What got you started?
No,
Uh,
I never
to
never really planned to be in administration. I was a clinical nurse specialist. I was one of the very few in the 1970s that was charting towards a nurse specialist program. My specialty was cardiovascular. Loved every minute of it. Loved every minute of it. Never really ever thought that I would be in administration. Never planned on it until the chief nursing officer called me into her office and said, I want to promote you to be the assistant vice president for the nursing division. And I said, but I don't know anything about being a vice president or assistant vice president. And of course, the person that I would be replacing was the person that hired me, who I thought was so up there. So in my mind, one, I was not qualified. Number two, I was not deserving of that position. And they said, well, you will learn and we will teach you. And so at age 21, 22, I was an AVP for St. Barnabas Medical Center in New Jersey.
so you said something that I'm curious about. You said that you didn't think you were deserving. Can you talk a little bit about that?
During my time, there were no coaches, there were no mentors. They just plug you in. If you're successful in the clinical field, they assume that you're going to be successful in the administrative field. And so sometimes people fail because there is just not a set of competencies that they can train you on. And so today, I think the world is kinder, the world of healthcare is kinder towards that transition. But during my time, there was none. So what I had to depend on is they were called director of nursing, who would sit down with me. And when I used to say to her, the problems just never end. When I'm at the bedside, I know I'm going to take care of the patient. I've done that. When I go home, I'm done. Here, the problem just lingers.
Never done.
And not only that, it just seems like it keeps coming back and re-entering just in a different format. But she said to me, Ninfa, I picked you because I saw a talent in you. You just have to believe in yourself, and I'll hold your hand along the way.
Oh.
But here's the one thing that I remember her saying to me: I don't know as much as you think I do, but I try to learn along the way. And that's probably my first lesson on unequivocal humility and vulnerability. And I just thought, how impressive is that? And I still carry that, today.
Talk to us a little bit about your career and the different moves you've made. And were there pivotal moments that changed the trajectory of your career?
Oh, absolutely. After I left New Jersey, I was at St. Barnabas Medical Center. My husband got transferred to Atlanta. So that was my real first time to look for a job in administration. When you're a nurse, you're so portable. You don't even worry about a job. You just go apply and you'll be hired. And it's really your choice. It is a market for nurses. When you're in administration, you've kind of narrowed down the opportunity. So I had the opportunity to interview at Emory. I was hired to be in charge of nursing administrative program, which includes staffing, which included human resources, which included retention, included education. And this is really my big foray into a large university hospital system. Well, I came from a teaching hospital. This is truly university-based. By that, I mean the hospital exists for the university. And so that's a slightly different orientation. And I had to really think about what that means. The structure is different, very strong academic slant. But I'll tell you, I'll learn more about my trajectory while I was at Emory. It's a very competitive place. You realize that. You're always driving into what is the next best thing. You've got a lot of brilliant, competent people that you're constantly being compared to. And that's when you begin to start to do an inventory of your skill sets. And that is when I realized that the one thing that I was missing is the business side of healthcare. And so I decided I was going to pursue an MBA program while I was working. And you can't really work and go to an MBA program at the same time. About that time, Emory had just started an executive MBA program. The country was just beginning to get into executive MBA program. And so they decided to put one at Emory, and I decided to apply. And I was told at the outset, we don't know if we could accept you. You have no business background. I said, well, how am I going to get one if you don't give me one? I said, I'm in the middle of running a division of the organization that I need to have a business savvy to be able to navigate it better. And so they said, well, you don't have a business background. Why don't you take the GMAT, and we'll see. I applied. The program started in January. I applied in April the year before the program was started. So now it's October, and everybody has already been accepted, and I haven't been notified. So I was very persistent. That's one thing you'll know about me. I'm very persistent. If I believe in a path, I will keep going until you slam the door in my face. Even then, I'll still keep asking. And so I went back and I said, I want you to give me an opportunity. And they told me that you would be the first clinician accepted to this program. And this program is very important to us because we're trying to develop a track record for the program. So to make a long story short, I told them, I'll do whatever you want me to do. I'll take whatever classes you want me to take, but please give me a chance. And finally, I guess they got sick and tired of me knocking at their door. They accepted me. So in January 1983, I started executive MBA program and finished in May of 1984. So I would be the first clinician accepted to the program. I have to tell you, I learned so much from my classmates. And that was another pivotal thing for me, that learning, even in an uncharted territory, can happen. You just have to have the ability to humble yourself, to know what you do not know. Number two, willing to learn on a fast track, willing to beg for people to tutor you when you don't understand it. And then fourth, take as much as you can, like a sponge, and learn from your classmates, because many of my classmates were CEOs of publicly trading companies, CEOs of huge companies. In fact, I was the only AVP, or assistant vice president, in that class. They used to tell me that they had to throw away my salary because it took the average salary of the class down. But I learned so much from my 24 classmates. If I study something, I will apply it until it becomes part of what I do. And there's not a day since 1984 that I have not used all the skill sets and the learning that I've learned from the executive MBA program.
You have such an amazing career. And you also have an amazing set of credentials. There are several letters after your name: a doctorate in health administration, master in business administration, master of science in nursing, certification in Six Sigma, as well as having attended the healthcare executive program at the Wharton School of the University of Pennsylvania, an international business program at the London School of Business. So you're married with family. How did you find the time? And you touched a lot about the education. So education, how important is it for your career growth?
So I come from an academic family. Both my parents are academicians. So it feels like academics is just part of what we do. I've always felt, my parents always told us, the more you know, the less you know. And I know you've heard the second one I'm going to say. My parents always said to us, we have no inheritance to give you, but the only thing we can give you is your education, and you can do with it whatever you want to, but that will be your passport to the future. And it will give you the ability to grow, to make a difference. And as an immigrant in this country, my parents used to say to me, you've been educated in this country, you have a responsibility to give back, to teach, and make sure that others are better because of you. And so academics has always been part of growing up. And so when I was actually already president at Virtual Health, having all these degrees and having gone to a lot of certification, I said to my mom, I said, Mom, I think I'm done. And I remember my mother saying to me, no, sweetie, you're not. I want you to get your doctorate. I said, I don't need it, Mom. I'm already the president of an organization. I'm in a good trajectory. She said, no. If you have an opportunity to learn every day, because the adage of the more you know, the less you know, if you can magnify that, then you can be a model for other people. And I will tell you, Fawn, that was really hard. And I think I went to the doctoral program, not because I wanted to, it's because I did not want to disappoint my mom and dad. And I would do anything to make sure that they were not disappointed. So I navigated through that doctoral program. I got so sick during that program because I was trying to build a brand new hospital at Virtua. I was trying to find financing for that along with the CFO. We're doing the partnership with GE at that time at Virtual Health. And then I have to go to this doctoral program. Well, my mother said the only time you say no is if you really truly cannot move your fingers, can't think, can't move. You just have to keep doing it. And I did.
Tough mom.
Yeah, she's a really tough mom. So I did that, and I finished the doctoral program actually in less than 2 years. And but it was just unbelievable, and I was very pleased to finish top of the class, even if I didn't want to really. But it's kind of really interesting is about the time that was in September, right? September is when this happened. I graduated in 2006. I was awarded as the youngest recipient of the Hall of Fame Alumni Award. That was given to me in September. I was going to take my mom with me, and she was just so excited. I think my mom deserved the award more than I did. But then my mom was diagnosed with lung cancer and then died 3 months later. So in many ways, I was so glad that she pushed me. I was so glad that I had an opportunity to make her happy. And of course, has benefited me a lot. When I think about my doctoral program, I'm a better writer today because of that program. I am a better researcher today because of that program. So, to your question about the value of education and the value of advancing knowledge, if we just can remember that the more we know, the less we know because we discover more. And when we think about education as a stepping stone towards discovery of yourself, discovery of new concepts, discovery of new organizations, the ability to apply them to make an organization better, one would then begin to think that education is just so critical to all that we do.
And how did you do it all? You were running a hospital, you have had a family, and getting a PhD. What? How did you do it?
It was very hard. It was very hard. And I will tell you, today I can honestly say, because I've had a conversation with my children, there were many times that I missed a lot of things from my kids. My oldest one, Maureen, I did not miss it as much because I really did not have as big a job as when Jamie, my second one, was in high school. And there were many moments that he was a varsity basketball player. He was a varsity baseball player. And he used to say to me, Mom, you just missed my 3-point shot because you were on the phone. And there were times that I would just not be able to be there. And so this is when you and your husband or your partner have to work together so that they can fill in and compensate for the gaps that's created by your being absent. So today, I really try the best I can to make up for it, to be there for them. But even when I was so busy, I would go to everything that they have. I may be late. I may only get the last 2 minutes of the game, but I made sure that I adjusted accordingly. The path to the success of a woman who happens to be a mother, a wife, and a daughter and a sister is a very complicated one. And for those that would be very forthcoming about it, something is going to be missed, something will be sacrificed. And it's going to be, that's why I don't really believe that there's such a thing as a work-life balance. You're constantly blending and mixing and blending and mixing. There's an incredible sacrifice on you, on your health, on the burden that you carry, the guilt that you carry. All those come together all at the same time. And sometimes they're not identifiable, they just come together in one whole bucket. Guilt and feeling bad is an appropriate feeling, but if it dominates how you feel and it
Yeah.
dominates what you do, then there will be no resting place or happiness in
Yeah.
the work that you do. Making sure that you're not a bad role model for people. I happen to feel that because I'm a workaholic, that would be one part that makes me not the best role model for many people. And so I always tell people, I go the opposite way. I always tell people, your family is your number one priority, and you must always take advantage of that. I will be here for you, because if you're happy at home, you'll be happy here at work, and you'll do a lot of good things here.
Let's switch gear a little bit and talk about women leaders in healthcare virtual conference, um, and about career growth. This conference is really focuses on equipping the attendees with the tools they need to advance their career. Um, You'll be there on a panel discussion. What makes you most excited about attending and participating? You've been our speaker at past conferences. So talk to us about, what are you excited about this year?
The thing that I constantly am excited about is the knowledge transfer. I think the ability to take people through experientially through some of the nuggets of wisdom that we have gone through would be very exciting to share. I think there was a time, and I remember, I think it was a 1970 study, it's called the Queen Bee Syndrome. It was very hard for women to see other women move up the track. And so once one moves up, the Queen Bee syndrome comes in, and they don't want anybody else around because there are just very few women on the top position. And so they kick them down, probably not consciously, probably subconsciously, but they're not giving them the bridge or the rope to go back up, or to help them come up. I think today, the world that we live in is so much more generous and so much more giving, so that people like me, or people in my generation and those immediately following me or before me, are so much more excited to develop new leaders. And so for me, if I can touch a person through my experience, and if I can show them a path forward through my experience, if I can help them navigate the natural challenges that comes in the world of women leaders, then I feel like I have done something that adds value to the women leaders that are coming up. Today, I really believe this, that the leaders of the future post-COVID may not be the same leaders that have been trained by tradition for many, many years. And so the ability for people to understand that there may be new skill sets, new competencies, and that those competencies do not only reside with experienced people, but people with no experience but has wisdom and knowledge can create an innovative approach to readiness towards leading an organization. What an incredible melting pot of ideas and competencies to move us forward. Somehow, through this COVID-19, we must be able to pull all our experiences, good, bad, and indifferent, and new and unusual, to propel us to what would be the new normal. So I think it's exciting that modern healthcare constantly gives women the opportunity to be able to have a forum, the ability to be able to connect as a group, the ability to connect individually, the ability to just sit there and listen and soak it all in, and the ability to affirm and ask questions and say, what do you think about this? And equally compelling, you giving people a forum of people like me and others who are much more experienced, much more competent than I am, to begin to translate their experience into a chewable or usable experience or learning.
Ninfa, I can't thank you enough for talking with me today. More importantly, thank you for all that you do and for your leadership, for being a good friend, a great role model to me personally. I can't wait to see you in a couple of weeks at the Women Leaders in Healthcare Conference, virtual conference. And thanks to everyone for tuning in. I look forward to seeing you in a couple of weeks with another episode of Fridays with Fawn.